Good morning, everyone. I am going to call this meeting of the Joint Subcommittee on Human Services to order. And Secretary, if we can call roll.
Assemblymember Brown-May. Here. Assemblymember Dickman. Here. Assemblymember Hafen. Assemblymember Hibbets. Here. Assemblymember Howdegi. Assemblymember Monroe-Moreno. Here. Assemblymember Yeager. Here. Senator Cannizzaro. Here. Senator Dondero-Loop. Here. Senator Stone. Here. Senator Titus. Here. Assemblymember Mosca. Here. Chair Wen.
Here. I believe we have all members. Nope, we are missing one present. One member is absent, excused for Assemblymember Howdegi. But otherwise, we do have a quorum and we are ready to go. Today, we have our first revised agenda. We have budget closings for the Department of Health and Human Services, Division of Public and Behavioral Health. And with that, we will get started and I will open up these closings and I will turn this over to Mr. Luna to go over the closing documents.
Thank you, Madam Chair. Members of the subcommittee, good morning. This is Justin Luna, for the record, program analyst with the Fiscal Analysis Division of the Legislative Council Bureau. Today I'll be presenting the closing recommendations for the Division of Public and Behavioral Health, the behavioral health side. If you recall, my colleague, Mr. Barlow, presented the closings for the division's public health budget accounts a few weeks ago on April 4th. These 9 budget accounts represent the behavioral health side of the division, and with my presentation today, we'll have covered all of the budget accounts for the division. First budget account begins on page 3 of the closing packet, the Behavioral Health Administration budget. This budget was heard by the subcommittee on March 12th. This is budget account 3168. There are no major closing issues. 2 other closing items. Fiscal staff recommends all other closing items be closed as recommended by the governor and requests authority for staff to make technical adjustments as necessary.
Thank you for that, Mr. Luna. Do we have any questions? Seeing none, I'd entertain a motion.
I motion to recommend to approve as stated by staff.
Second.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Passes unanimously. The motion carries, and we will move on to our next budget. Go ahead and begin when you're ready, Mr. Luna.
Thank you, Madam Chair. Justin Luna, for the record. The next budget account is on page 5, Southern Nevada Adult Mental Health Services, budget account 3161. This was also heard by the subcommittee on March 12th. The major closing issues begin on page 6 of the closing packet. The first major closing issue, the governor recommends general fund appropriations of $17.6 million over the 2025-27 biennium to provide staffing and operational services for the renovated forensic building, Building 3A, on the SNAMS campus. Including the addition of 53 new full-time positions with associated operating costs, along with funding for professional service contract costs to support 21 additional forensic beds. The building is currently being renovated with costs funded through American Rescue Plan Act, ARPA, Coronavirus State Fiscal Recovery Funds, and is anticipated to be completed by May 2025. All 53 new full-time positions are funded with a July 1st, 2025 start date. During the March 12th budget hearing, the agency expressed understanding of the urgency to get the additional forensic beds operational as quickly as possible and explained the planned approach to hire the recommended additional staff and distribute the new positions throughout the agency's existing units to provide proper training and ensure operational effectiveness by blending with experienced staff. The decision for the subcommittee at the bottom of page 8. Does the subcommittee wish to recommend approval of the governor's recommendation for general fund appropriations of $17.6 million over the 2025-27 biennium, which is $8.9 million in fiscal year 2026 and $8.7 million in fiscal year 2027, to provide staffing and operational services for 21 additional forensic beds in the renovated forensic building, Building 3A, on the SNAMS campus?
Thank you. Do we have any further discussion? I do have a question, and I'm not sure if Administrator Finney or if Director Whitley. I did see Mr. Rob here earlier, but I don't see him here anymore. If we have any update on that project and whether or not we are still set to be able to open it July 1, 2025.
Good morning. You ready? Cody Finney for the record. Yes, we did meet with Director Rob and others from Public Works and that aspect of the organization, and also with the licensing body yesterday, and the project is on schedule to open July 1st.
Thank you. I appreciate that update. I know things change really quickly in the construction and renovation world, so I appreciate that. I'm glad to hear that. With that, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. The motion carries, and we'll move on to the next closing item.
Thank you, Madam Chair. Justin Luna for the record. Second major closing issue is on page 9. The governor recommends a general fund appropriation of $1 million in fiscal year 2027 to continue the use of skilled nursing facilities for forensic and civil patients as part of the overall plan from the agency to address the ongoing shortage of forensic beds. As background, the agency received $5.1 million in fiscal year 2024 in federal ARPA funds for the transfer of forensic and civil patients who were occupying long-term inpatient beds at the division's clinical services facilities to appropriate levels of care in licensed skilled nursing facilities in the community, which allowed those long-term beds available at state facilities to provide forensic inpatient restorative services. During the budget hearing, the agency explained that the 239 total forensic beds statewide, 35 of those beds are occupied by individuals with long-term commitments. The use of skilled nursing facilities to provide care for those long-term commitments makes additional beds available to cycle through multiple forensic clients. The agency provided an update on the number of forensic and civil patients that are receiving care in licensed skilled nursing facilities with the use of ARPA funding, indicating that there are currently 10 individuals that are part of this program. In order to align projected costs anticipated for the 2025-27 biennium, the budgetary authority built into the adjusted base budget, fiscal staff recommends a technical adjustment to revise the ARPA revenue and associated expense authority in base to reflect $1 million in fiscal year 2026 and $500,000 in fiscal year 2027 to continue the use of skilled nursing facilities for forensic and civil patients based on projections from the agency. And given the agency's projection to spend approximately $1 million in fiscal year 2026 using ARPA revenue, it appears reasonable to expect similar projections in fiscal year 2027, with the agency projecting $500,000 in ARPA revenue to continue the use of skilled nursing facilities for forensic and civil patients through the scheduled expiration of federal ARPA funds on December 31st, 2026. Reducing the recommended general fund appropriation would provide the agency with $1 million in expenditure authority, which is $500,000 in ARPA revenue and $500,000 in general fund appropriations for fiscal year 2027. The options on page 10 for the subcommittee to consider. Option A, does the subcommittee wish to recommend approval of the governor's recommendation for a general fund appropriation of $1 million in fiscal year 2027 to continue the use of skilled nursing facilities for certain forensic and civil patients, and the technical adjustment to reflect ARPA coronavirus state fiscal recovery funds revenue authority of $1 million in fiscal year 2026 and $500,000 in fiscal year 2027 for this same purpose based on the projections provided by the agency? Or option B, does the subcommittee wish to recommend approval of a general fund appropriation of $500,000 in fiscal year 2027 to continue the use of skilled nursing facilities for certain forensic and civil patients, and the technical adjustment to reflect ARPA coronavirus state fiscal recovery funds Revenue Authority of $1 million in fiscal year 2026 and $500,000 in fiscal year 2027 for this same purpose based on the projections provided by the agency.
Do we have any other questions from the committee? Seeing none, I'd entertain a motion.
I motion to approve option B as stated by staff.
Second.
All those, any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Passes unanimously. If we can move on to the next major closing issue.
Thank you, Madam Chair. Justin Luna for the record. Major closing issue number 3, the bottom of page 10. Governor recommends transfers from the Department of Health and Human Services Director's Office, Fund for Resilient Nevada, budget account 3060, $1 million over the 2025 biennium to provide a subaward to the City of North Las Vegas Fire Department to expand a crisis response team model that provides mental health and opioid support through crisis response calls and community education outreach. This project is recommended to be funded through the Fund for Resilient Nevada, the Fund for Resilient Nevada budget account, which was heard by the subcommittee on February 6th, allocate settlement money received by the state from litigation concerning opioids based on a needs assessment and statewide plan. During the budget hearing, the agency provided an update on the status of the crisis response team in the city of North Las Vegas and described the impact the additional funding would have on the team's operations to expand mental health services to include an opioid co-occurring component. The agency also clarified that the original pilot crisis response teams were funded with federal grants, but then transitioned to opioid settlement funding as the teams demonstrated effectiveness with objectives that align with the goals of the opioid needs assessment and statewide plan. The Interim Finance Committee approved initial opioid settlement funding of $200,000 for the crisis response team in the city of North Las Vegas at its December 12th, 2024 meeting. The decision for the subcommittee on page 11, does this subcommittee wish to recommend approval of the governor's recommendation of transfers from the Department of Health and Human Services Director's Office, Fund for a Resilient Nevada budget account of $500,000 in each fiscal year of the 2025-27 biennium to provide a subaward to the City of North Las Vegas Fire Department to expand a model that provides mental health and opioid support through crisis response calls and community education outreach.
Do we have any questions about this? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
I'm sorry, I didn't do this for the record, and I apologize to our staff. A motion from Assemblymember Mosca, a second from Senator Dondero Loop. Any further discussion on this motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. And again, I apologize to staff because I realized I wasn't identifying who made motions. So thank you and for your patience on this. If we can move on to the next major closing item.
Thank you, Madam Chair. Justin Luna for the record. Major closing issue number 4 begins at the bottom of page 11. The governor recommends general fund increases to add new full-time positions and associated costs based on the agency's caseload staffing projections. The agency's caseload staffing calculations project the need for 2 new full-time psychiatric caseworker positions in the division's justice-involved diversion intensive service coordination misdemeanor program, which offers diversion for misdemeanor level justice-involved adults with mental illnesses into community-based treatment options. During the budget hearing, the agency indicated there is an increased demand for the program, along with the increased level of acuity contributing to the increases in caseload for the programs, and why the recommended positions are critical to ensure adequate staffing ratios. The agency confirmed that it does not anticipate any issues filling the recommended positions. The decision for the subcommittee at the top of page 13 of the closing packet. Does the subcommittee wish to recommend approval of general fund appropriations of $361,287 over the 2025-27 biennium to fund 2 new full-time psychiatric caseworker positions and associated costs based on the agency's caseload staffing projections?
Just to remind the committee members that are new on the committee and a refresher for those that have previously served, we are just now receiving some of these new caseload projections. We've received them over the last 2 weeks, and so that's why some of these adjustments you're seeing come in on this. And with that, I would, if there are no further questions, I'd entertain a motion.
Thank you, Chair. I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator John Darrow Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously, and if we can move to the next major closing item.
Yes, ma'am. Thank you, Madam Chair. Justin Luna for the record. Major closing issue number 5 on page 13. The governor recommends general fund reductions totaling $613,030 to eliminate 4 existing positions. The existing positions were vacant at the time of the agency's requested budget submission. However, the agency indicates that all 4 positions have since been filled during the budget hearing, and that the agency has worked with fiscal staff to determine alternate vacant positions to eliminate instead in an effort to not disrupt an individual that is in a filled position. In a follow-up request, the agency confirmed that 2 of the positions could be moved into comparable vacant positions internally within the division, which does not require a change to the recommended eliminations for those positions. For the other 2 positions, fiscal staff requests authority to make technical adjustments to replace the elimination of the now filled clinical program manager and auditor positions with 2 vacant clinical program planner positions as requested by the agency, which results in an additional reduction in general fund appropriations of $89,448 over the 2025-27 biennium, bringing the adjusted total to $702,478 over the 2025-27 biennium. The decision for the subcommittee at the bottom of page 13. Does the subcommittee wish to recommend approval of a reduction in general fund appropriations of $348,703 in fiscal year 2026 and $353,775 in fiscal year 2027 to eliminate 4 existing full-time positions, including 2 clinical program planner positions, 1 auditor position, 1 administrative assistant position, and 1 consumer services assistant position, which is inclusive of the technical adjustments to replace the recommended elimination of the now filled clinical program manager and auditor positions with 2 vacant clinical program planner positions.
Do we have any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Darrow Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Passes unanimously. We can move on to the next one.
Thank you, Madam Chair. Justin Luna for the record. Major closing issue number 6 begins on page 14. The governor recommends reducing general fund appropriations by $3 million over the 2025-27 biennium to eliminate residential costs added during the adjusted base budget review process in the transitional living, mental health court, and community diversion special use expenditure categories. The agency indicates that if the residential costs are reduced as recommended by the governor, it would not be able to meet the demand for serving individuals who are court-ordered for misdemeanor diversion and specialized service coordination programs, and as a result would not be able to divert clients from forensic hospital waiting lists to these services. Based on information provided by the agency, there is an increased demand for outpatient residential services for individuals who are court-ordered for misdemeanor diversion and specialized service coordination programs. Additionally, more individuals need outpatient residential services upon discharge from statewide forensic hospitals when deemed incompetent to stand trial. State provides services as a safety net provider for these types of housing and supportive services, including for individuals whose needs are too complex and severe for the community to provide. During the budget hearing, the agency discussed the factors contributing to increased expenditures in fiscal year 2024 and projected expenditures in fiscal year 2025 in the transitional living, mental health court, and community diversion programs, and confirmed the expectation the trend of increasing demand would continue. The decision for the subcommittee in the middle of page 15. Does the subcommittee wish to recommend approval of the governor's recommendation to reduce general fund appropriations totaling $3 million over the 2025-27 biennium in the transitional living, mental health court, and community diversion special use expenditure categories.
And thank you for that presentation. I just want to make this very clear. This is programming that currently exists. It was not recommended, it was reduced and eliminated in the governor's recommendation budget. But I think we heard during the hearing, I think we heard from community members and people that called in over the last couple of months that these programming as a part of a holistic service that is definitely needed in our community. And with that, I don't see any other questions. I would entertain a motion.
Thank you, Chair. I would move to not recommend approval of the governor's recommendation to reduce general fund appropriations totaling $3 million over the 25-27 biennium in the transitional living, mental health court, and community diversion special use expenditure categories.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Dondero Loop. Do we have any discussion on the motion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. The motion carries. Mr. Luna, you're up again.
Yes, ma'am. Thank you, Madam Chair. Justin Luna for the record. Major closing issue number 7. Governor recommends a reallocation of expenditure authority totaling $3.4 million in each fiscal year of the 2025-27 biennium to eliminate positions that have been vacant for extended periods of time and utilize the associated funding for professional services to hire temporary contract staff for difficult-to-fill clinical positions. The positions provide direct clinical care to patients, and the agency has been backfilling the vacancies with temporary contract staff to maintain essential services. The agency indicates that eliminating the ability to perform the work assigned to the state positions would compromise the division's ability to provide the required direct care to clients unless the authority is reallocated to contracts with professional service providers as recommended. Historically, the agency has kept vacant, difficult-to-fill clinical positions in the budget with a standard practice of seeking approval during the interim through the work program process to transfer excess authority from vacancy savings into the professional services expenditure category to hire temporary contract staff to continue to provide the required direct care to clients. This recommendation to eliminate state positions for contract expenditures would represent a change in policy from previous practice. During the budget hearing, the agency provided additional information about the potential impact to the agency's operations if the reallocation of expenditure authority is not approved for contract staff, indicating that it would impair the agency's ability to continue to provide services at current levels. While the fiscal staff notes, while the agency indicates an impairment to continue to provide services at current levels, if this recommendation is not approved, the agency would continue to have the ability to request work program revisions to move authority from the personnel expenditure category to an operating category to hire contract staff, which is the process currently utilized by the agency. Additionally, the agency indicated in the budget hearing that eliminating a vacant state position for temporary contract staff does not result in a one-for-one offset. In a follow-up request, the agency provided additional information to quantify that the average cost for a temporary contract position is higher than a full-time state position. The decision for the subcommittee at the top of page 18. Does the subcommittee wish to recommend approval of reallocating expenditure authority totaling $3.4 million in each fiscal year of the 2025-27 biennium to eliminate long-term vacant state positions and utilize the associated funding for professional services to hire temporary contract staff to perform the duties of difficult-to-fill clinical positions?
Do you have any questions about this? Seeing none, I did. Oh, wait. Go ahead, Senator Titus.
Thank you, Madam Chair. Just out of curiosity, if we do not go along with the recommendation, will they, and they're vacant, will they still be able to contract with the needed professionals?
Justin Luna for the record, through you, Chair, to Senator Titus.
Feel free to go direct.
Thank you. Senator, to your question, the agency would be able to request a work program through the interim finance committee to reallocate expenditure authority from the personnel category where the position expenditure authority will be recommended if this is not approved. In order to shift that down to a special use category, that would allow them to use that expenditure authority for contract costs.
But going through that process, would there be any interruption in care?
Justin Luna, for the record, to your question, it's my understanding that the budget includes initial authority for contract costs. And so as the agency reviews their spending throughout the fiscal year, and if they anticipate a shortfall in contract costs, they would be able to come to IFC at that point.
And just so I can make this clear, Mr. Luna, this is the way we have currently been doing it for a considerable amount of time. So not approving this would leave us in the same position that we have been for, I think, decades.
Yes, Madam Chair. For the record, Justin Luna, not approving it would maintain the current practice that the agency uses.
Do we have any other further questions? Seeing none, I'd entertain a motion.
I would move not to recommend approval of reallocating expenditure authority totaling $3.4 million in each fiscal year of the 25-27 biennium to eliminate long-time vacant state positions and utilize the associated funding for professional services to hire temporary contract staff to perform the duties of difficult-to-fill clinical positions.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed, say nay. The motion carries, and we'll move on to the final closing item on this budget. Go ahead and begin.
Thank you, Madam Chair. Justin Luna, for the record. On page 18, there are 15 other closing items. Other closing item 8 is contingent upon the approval of a budget account that the subcommittee recommended for approval on April 4th. 12 and 13 recommend language in the Pay Bill and Appropriations Act, respectively. 14 and 15 are technical adjustments to add in authority for ongoing ARPA projects. On page 19, fiscal staff recommends other closing items 1 through 13 be closed as recommended by the governor, with other closing item 8 contingent upon the approval of Decision Unit E906 in the Office of Health Administration Budget Account 3223 and Healthcare Facilities Regulation Budget Account 3216. Budget accounts with approval of inclusion of language in the pay bill to allow unclassified psychiatrists to receive on-call coverage compensation as noted under other closing item 12. Approval of inclusion of language in the Appropriations Act as noted under other closing item 13, and closing other closing items 14 and 15 with the noted technical adjustments to reflect ARPA revenue authority of $6.3 million in fiscal year 2026 and $1.1 million in fiscal year 2027 for the Recuperative Care Center in Las Vegas and $4.9 million in fiscal year 26 and to continue support for the jail-based programming project with Clark County and Washoe County based on agency projections, with authority for fiscal staff to make other technical adjustments as necessary.
Do we have any other questions regarding this? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed, say nay. The motion carries unanimously. And before we close out this budget, I would ask staff to kind of discuss some of the jail-based programming that we discussed during the budget hearing, and I know that they have had some follow-up discussions with both Clark County and Washoe County, as well as the Las Vegas Metropolitan Police Department and the Washoe Sheriff as well. So if we could kind of move to a brief synopsis of that, I think that would be greatly appreciated for discussion.
Yes, ma'am. Justin Luna, for the record. I will note on page 20 additional information that has been provided for the subcommittee based on discussions from the March 12th, 2025 budget hearing. Subcommittee asked the agency to provide an update on the status of the current jail-based programming project with Clark County and Washoe County funded with ARPA funds. The division received approval at the December 13th, 2023 IFC meeting to use ARPA funds totaling $14.9 million during the current biennium to support jail-based programming for forensic clients in Clark County and Washoe County. As of March 25th, the agency has spent approximately $5.9 million of the ARPA allocation, with approximately $9.1 million remaining for the project. After the hearing, subcommittee members were interested in obtaining additional information about the jail-based programs managed in Clark County and Washoe County with support from the division. Clark County and Washoe County provided information on additional resources needed to continue the jail-based programming project past the scheduled period of performance for the ARPA funds of December 31st, 2025. Washoe County provided a high-level breakdown of estimated costs to continue operations of its jail-based mental health unit from January 1st, 2026 to June 30th, 2027, totaling approximately $7 million. Clark County provided budget projections to continue operations of the Specialized Mental Health and Recovery Treatment Program, or SMART program, and provided estimates from July 1st, 2026 to June 30th, 2027, totaling approximately $8.1 million. That concludes my presentation of this information.
Hello. Thank you for that update. I do see Administrator Finney at the table, and I'm just hoping if you might have found us some money or some solutions for this problem. So I'll turn it over to you to see if we can get any further update on those conversations that you've had about being able to continue this.
Cody Finney for the record. Haven't found complete solutions. We are asking that any pennies we have left from ARPA be used for this purpose to keep it going as long as possible. The program has been very successful, and it was my understanding that you might have questions for us. We do have information on the numbers of people and so forth if anything is useful to the committee.
I guess my question is I know that you are all in the process of looking to see where you might have unspent ARPA funds. Obviously, this was a previously ARPA-funded program. When do you think you might have an idea of how you might be able to fund this moving forward with some of those unspent ARPA funds?
Thank you, Cody Finney, for the record. We provided some information yesterday and will continue to do so. I expect we'll have information related to the ARPA funds and how we might be able to use those to keep things moving forward as long as those funds are good. As we all know, those funds end. We also have some support. We'll have those in the next week to 10 days. We also have some information that supports the use of opioid settlement dollars for this population, if that's something that the larger body would like to consider.
No, I appreciate you coming with solutions. I know one of the asks that we were also going to encourage the county to kind of go back to look to see if what scaled back programs might look like, if we had like reduced funding in these areas, or if there's any other options for some of those. We don't plan on making any decisions today regarding this item and the funding of this item, but we do want to make sure that we have a big bookmark here as we have a better understanding of what the financial landscape looks like in the next couple of weeks. But I appreciate you giving us that update and trying to come up with real solutions for a program that seems to be really helping in the holistic population within those jails to cut down on the wait lists, our contempt of court charges that are ever growing. So I appreciate that. Do we have committee have any other questions for the administrator before I let her step back? Seeing none, thank you for giving that update and allowing me to pontificate about this. I think it's a important program, and when we see programs that are working really well, I'd like to be able to continue them, and I think that is the desire of this entire committee. So if we can find a way, I know we will do what we can on this end. With that, we will close. There's no decision to be made, so we will close that budget, and we will move on to 3162, the Northern Nevada Adult Mental Health Services budget accounts, and it will sound a little bit like deja vu, which is because it is. And with that, I'll turn it over to Mr. Luna.
Thank you, Madam Chair. Justin Luna for the record. Budget account 3162, heard by the subcommittee on March 12th, begins on page 23 of your packet. There are three major closing issues, and as the chair referenced, these are similar to the major closing issues, to some of the major closing issues that were presented in the previous budget account. Major closing issue number one, the governor recommends funding over the biennium for new positions based on the agency's caseload staffing projections. And these are new positions to support increasing needs for the division's following programs: outpatient assessment and counseling, forensic diversion service coordination, intensive service coordination, mental health court, and assisted outpatient treatment. Based on the division's preliminary caseload analysis, the executive budget recommends $1.4 million over the biennium, with $1.2 million in general fund appropriations to add 6 positions and increase 1 part-time position to full-time in fiscal year 2026 and 1 additional position in fiscal year 2027. The recommendation includes 3 new mental health counselor positions, 4 new psychiatric caseworker positions, and the increase of 1 existing vacant part-time unclassified senior psychiatrist position to full-time. These recommendations would appear to establish new caseload staffing ratios for mental health counselor positions for the outpatient assessment and outpatient counseling programs, as a staffing ratio was not approved during the 82nd legislative session in 2023. Also, this recommendation would establish a new caseload staffing ratio for the unclassified senior psychiatrist position within the assisted outpatient treatment program, as the staffing ratio was not approved during the 82nd legislative session in 2023. During the budget hearing, the agency indicated the increased level of demand along with the increased level of acuity factors for the recommended increases. As the chair indicated earlier, we did receive updates from the agency with updated caseload projections on March 21st. The updated caseload projections for the Forensic Diversion Service Coordination Program are higher than the governor's recommended budget, which results in the need for 1 additional psychiatric caseworker based on the staff to client ratio. The agency indicated that increases in the justice-involved diversion programs are growing faster than the anticipated, as more eligible individuals are being diverted to appropriate alternative programs in an effort to reduce the forensic wait list. Based on the updated caseload projections, an additional $116,422 with $98,272 in general fund appropriations in fiscal year 2027, above what is recommended in the executive budget, would be needed to add 1 additional psychiatric caseworker position and associated operating costs effective July 1st, 2026. And I'll note for the record, on the bottom of page 25, there is an error in the closing packet. The effective date lists July 1st, 2027. However, that should be July 1st, 2026, which is the beginning of fiscal year 2027. So the decision for the subcommittee on page 26, does the subcommittee wish to recommend approval of decision unit M201 to support caseload adjustments based on caseload projections updated March 2025 for 9 additional positions, including 1 senior psychiatrist, 3 mental health counselors, and 5 psychiatric caseworkers, funded with $1.5 million, $1.3 million in general fund.
Thank you. Any further questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Dondero Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries, and we can move on to the next closing item.
Thank you, Madam Chair. Justin Luna for the record. Major closing issue number 2 on page 26. Governor recommends a reduction in general fund appropriations totaling $905,585 over the biennium to eliminate 5 existing vacant positions with minimal impact to operations, according to the agency, due to difficulty recruiting and other operational factors, the responsibilities of the positions have been absorbed effectively by the division, either through a decrease in demand for certain pharmacy and laboratory services or by using contract services to meet the need. The decision for the subcommittee on page 27. Does the subcommittee wish to recommend approval of a reduction in general fund appropriations totaling $905,585 over the 2025-27 biennium, $448,180 in fiscal year 2026, and $457,405 in fiscal year 2027 to eliminate 5 existing vacant positions, which is 4.51 FTE, including 1 full-time unclassified pharmacist position, 1 full-time licensed psychologist, 1 position, 1 full-time psychiatric nurse, 2 position, 1 full-time microbiologist, 4 position, and 1 half-time laboratory technician, 1 position.
Any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Darrow Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously, and we'll move on to the next one.
Thank you, Madam Chair. Justin Luna for the record. Major closing issue number 3 on page 27. Governor recommends a reallocation of expenditure authority totaling $2.5 million over the 2025-27 biennium to eliminate 14 positions that have been vacant for extended periods of time, utilize the associated funding for professional services to hire temporary contract staff. Fiscal staff would recommend that the subcommittee's recommendation for this item be consistent with the subcommittee's action on decision unit E652 in the Southern Nevada Adult Mental Health Services budget account that we just heard. So the decision for the subcommittee on the top of page 29, does the subcommittee wish to recommend approval of reallocating expenditure authority totaling $2.5 million over the 2025-27 biennium to eliminate long-term vacant state positions and utilize the associated funding for professional services to hire temporary contract staff to perform the duties of the difficult-to-fill clinical positions?
And just to make it clear again, this is keeping the status quo. It is not eliminating any of the authority to be able to come to IFC and fill these positions. We are just likely going to be consistent, and with that, I will entertain a motion.
I move to not recommend approval of reallocating expenditure authority totaling $2.5 million over the 25-27 biennium to eliminate long-time vacant state positions and utilize the associated funding for professional services to hire temporary contract staff to perform the duties of difficult-to-fill clinical positions.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Darrow Loop. All those in favor say, any discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously, and we will move to the last closing item on this budget.
Thank you, Madam Chair. Justin Luna for the record. There are 10 other closing items. Fiscal staff recommends other closing items 1 through 9 be closed as recommended by the governor, with other closing item 8 contingent upon the approval of decision unit E906 in the Office of Health Administration, budget account 3223, and Health Care Facilities Regulation budget account 3216 budget accounts, and approval of inclusion of language in the Appropriations Act as noted under other closing item 10, and request authority for fiscal staff to make technical adjustments as necessary.
Any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Don Darrow Loop. All those any further discussion on the motion? Getting too fast here. Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. The motion carries unanimously, and that will bring us to our next budget, which is 3170. I'll go ahead and begin when you're ready.
Thank you, Madam Chair. Justin Luna for the record. Next budget account, as you mentioned, 3170, the Behavioral Health Prevention and Treatment, was heard by the subcommittee on March 12th. There are 2 major closing issues. The first major closing issue, the governor recommends the transfer out of 3 positions for the division's Office of Suicide Prevention and associated cost funding within the budget account to the division's Crisis Response budget account. Recommendation, or the recommended transfer involves a portion of the division's Office of Suicide Prevention staff, except one unclassified statewide suicide prevention coordinator position that is funded with general fund appropriations and recommended to remain in the behavioral health prevention and treatment budget account. During the budget hearing, the agency outlined how the responsibilities of the division's Office of Suicide Prevention align closely with the division's crisis response program and described how the recommended transfer would improve overall coordination for the services related to behavioral health crises. The agency confirmed its intent to not transfer general fund appropriations into the division's crisis response budget account. Additionally, the agency indicated that the program staff and operation costs recommended for transfer were historically funded exclusively with Healthy Nevada funds or tobacco settlement funds. However, based on updated revenue projections from the Treasurer's Office, Healthy Nevada funds are projected to decrease over the 2025-27 biennium. According to the agency, the recommended transfer would align the related programs to enhance collaboration and ensure a more stable funding source using the telecom fee surcharge revenue in the division's crisis response budget account, which is used to support the operations of the behavioral health crisis hotline and the services provided to persons who access the hotline. And this would offset the shortfall of the Healthy Nevada funds. Budget account or budget amendment A255193-170 transmitted by the Governor's Finance Office on March 17th recommends reducing Healthy Nevada funds in alignment with that to reconcile the updated revenue projections from the Treasurer's Office. And it also reconciles the revenue authority associated with the transfer. The decision for the subcommittee on page 33. Does the subcommittee wish to recommend approval of the governor's recommendation to transfer out $895,022 over the 2025-27 biennium with general fund appropriations of $51,485 and tobacco settlement funds of $843,538 to the crisis response budget account to transfer out 3 positions associated with the division's Office of Suicide Prevention? And does the subcommittee wish to recommend approval of budget amendment A255193-170 as recommended by the governor to reduce tobacco settlement funds totaling $44,138 over the 2025-27 biennium based upon updated revenue projections from the Treasurer's Office and to increase general fund appropriations by $38,085 over the 2025-27 biennium to reconcile the transfers in Decision Unit E900 and to eliminate residual authority of $3,027 in fiscal year 26 and $3,026 in fiscal year 2027, inadvertently remaining in the Youth Suicide Prevention Special Use Expense category.
Any questions regarding this? I'd also note for the record, I think I'd previously marked her absent excuse. Assemblymember Howdigi is present with us today, so if we can mark her present. And with that, I'll entertain a motion.
I motion to approve as stated by staff.
Second.
I have a motion from Assemblymember Mosca, a second from Senator Dondera Loop. Any further discussion on this motion? Seeing none, all those in favor say aye. Aye. Anyone opposed, say nay. The motion carries unanimously, and we will move on to the next major closing item.
Thank you, Madam Chair. Justin Luna for the record. Major closing issue number 2 through 6 separate decision units. The governor recommends Governor recommends federal funds totaling $4.5 million over the biennium to add 17 new full-time positions with associated costs, to provide technical support and to subgrantees and implement initiatives related to various federal grant programs, including the comprehensive response to the opioid epidemic, substance use prevention, treatment and recovery services, community mental health services, and youth suicide prevention and early intervention programs. Although the decision units are presented together in this major issue, the subcommittee may decide on each decision unit separately and independent of each other. The various federal funding sources are all regular ongoing grants that have project periods extending beyond the 2025-27 biennium, according to the agency. However, the agency also indicates that if funding was reduced or eliminated by the federal government, then the agency would likely eliminate the associated positions. There are details on each of the decision units and the positions requested on the following two pages, 34 and 35. The agency provided details of each of the requests during the budget hearing. The agency noted that the federal grants associated with the recommended new state positions are stable and in alignment with the current federal administration based on the information available at the time of the budget hearing. Agency also confirmed that the majority of the federal grant awards would continue to be subgranted to service providers in the community, and the recommended new state positions would provide oversight and technical assistance to the subgrantees in a grants management capacity. The agency indicated it does not anticipate any issues filling the recommended new positions. The decision for the subcommittee on page 36. Does the subcommittee wish to recommend approval of 1, Decision Unit E 225, $1.1 million in federal opioid strategic response grant funds over the 2025-27 biennium to add 6 new positions to provide support for the comprehensive response to the opioid epidemic. Number 2, Decision Unit E 226, $584,560, let me start over. Decision Unit E 226, $584,596 in federal SAMHSA SUPTERS block grant of funds over the 2025-27 biennium to add 3 new mental health counselors. Number 3, Decision Unit E 227, $563,549 in federal SAMHSA SUPTERS block grant funds over the 2025-27 biennium to add 2 new health program managers and 1 new business process analyst. Number 4, Decision Unit E 229, $380,789 in federal block grants for community mental health services over the 2025-27 biennium to add 1 new health program manager and 1 new management analyst to convert contract staff to permanent state positions. Number 5, Decision Unit E 231, reallocation of expenditure authority totaling $370,091 over the 2025-27 biennium to add 1 health resource analyst and 1 management analyst to support the Nevada SPF PFS grant, offset by a reduction in aid to nonprofit organizations and non-employee in-state travel, and or number 6, Decision Unit E 232, $1.4 million in federal Garrett Lee Smith Tribal Youth Suicide Prevention Grant funds over the 2025-27 biennium to add 1 new health program specialist with associated operating costs totaling $176,435 over the 2025-27 biennium and approximately $1 million over the 2025-27 biennium for pass-through of federal grant aid to nonprofit organizations, along with $279,086 over the 2025-27 biennium for contract positions. Thank you.
Thank you. You did a great job of reading all those numbers. I know that it always seems like it's going to be easier to do that than it is, so I appreciate it when people are able to do it so efficiently. I just wanted to confirm, I know you had mentioned this, but the agency during that March 12th, 2025 hearing confirmed that the majority of these federal grant awards would continue to be subgranted to service providers as they currently are being administered. Is that correct?
Yes, Madam Chair, Justin Luna for the record, that is correct.
And that by creating this another level of administrative costs, it wouldn't come from general funds, but it would be coming from those subgrantees that are currently administering these programs. Is that correct too?
Madam Chair, Justin Luna for the record, the federal grants allow a certain percentage of administrative costs taken from the grant to be able to provide grants management and allows for the positions to support the federal grants.
Thank you. And then also during that hearing, the agency also indicated that they would likely, these wouldn't be state employees, they would contract out with another outside organization to do this work. Is that correct?
Madam Chair, Justin Luna for the record. To clarify, these recommendations are for state positions that would support the subgrantees with technical assistance and other matters relating to grant management in terms of reviewing reports that the subgrantees provide to make sure that projects are in line with the grant objectives, to make sure that subawardees are spending down grant funds in a timely manner, those types of things.
Thank you. Any further questions on this matter? Seeing none, I'd entertain a motion.
Thank you, Chair. Committee, I would move to not approve the recommended positions in the following decision units, but to instead approve the federal grant authority to be placed in the associated special use expenditure category for the purposes of providing subgrants to local government agencies, nonprofits, and other community providers to carry out the objectives outlined in the federal awards. Each amount represents a 2025 to 27 biennium total for the decision unit. Decision Unit E225, $1.1 million in federal opioid strategic response grant funds. Decision Unit E226, $584,596 in federal substance abuse and mental health services administration substance use prevention, treatment, and recovery services, SAMHSA SUPTERS block grant funds. Decision Unit E227, $563,549 in federal SAMHSA SUPTERS block grant funds. Decision Unit E229, $380,789 in federal block grants for community mental health services. Decision Unit E231, $370,091 in federal strategic prevention framework partnership for success grant, and Decision Unit E232, $1.4 million in federal Garrett Lee Smith Tribal Youth Suicide Prevention grant funds.
Second?
I have a very long motion that was also had lots of numbers in it from Assemblymember Mosca, a second from Senator Don Darrow Loop. Do we have any discussion on the motion? Seeing none, oh wait, we do. Senator Titus, go ahead.
Thank you, Madam Chair. Just want to make sure that this would be consistent in line with prior authorization of use of these grants, and we wouldn't be in danger of losing the grants.
Justin Luna, for the record. Senator Titus, to address your question, the expenditure authority that would be recommended in the motion would still be aligned with each specific grant, and the agency would need to make sure that that expenditure authority is spent in line with the federal grants.
Any other discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously. And I think we have one final closing item.
Yes, ma'am. Thank you, Madam Chair. Justin Luna, for the record. On page 37, there are 8 other closing items. Other closing item 7 reclassifies a position. Other closing item 8 is reduction in federal funds for expiring grants that are going to be expired shortly before or during the biennium. Fiscal staff recommends a technical adjustment to reallocate residual revenue totaling $39, also in one of the, as part of the federal reductions. Fiscal staff recommends other closing items 1 through 7 be closed as recommended by the governor. Other closing item 8 be closed as recommended by the governor and with the noted technical adjustment, and requests authority for fiscal staff to make other technical adjustments as necessary.
Any questions? Seeing none, I'd entertain a motion.
I motion to approve as stated by staff.
Second?
Motion from Assemblymember Mosca, a second from Senator Don Darrow Loop. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries, and that will close out that budget. Next, we will hear briefly on the crisis response, problem gambling, alcohol tax program, Lakes Crossing Center, and rural clinics. And Mr. Luna, if you could pause after each one to see if we have any questions from the committee members, but otherwise we can just power through these ones.
Yes, ma'am. Thank you, Madam Chair. Justin Luna, for the record. I'll now begin presenting the budgets for which the subcommittee has not previously reviewed for the agency and for which fiscal staff is responsible for developing closing recommendations. I will pause following my presentation of each budget to allow for questions. When I presented the last budget in this group and questions have been addressed, the chair may wish to ask for a single motion for closing consideration on all of the budget for which fiscal staff is responsible for developing recommendation. First one on page 39, the crisis response budget account 3165. Division is required to establish a 988 hotline for people having a behavioral health crisis, provide a support center for to respond to crisis calls, and establish mobile crisis teams using telecom fees that are deposited into the budget account, which are used to support the operations of the behavioral health crisis hotline and the services provided to persons who access the hotline. There are no major closing issues. 5 other closing items, including the transfer in of the positions that we presented in budget account 3170. And as a reminder, or on other closing item number 5, there was a budget amendment that reconciles the revenue reallocation in the adjustment to the transfers. As a reminder, the closing recommendations for this budget account are included on the summary page in the closing packet. Are there any questions on this budget account?
Any questions? Seeing none, go ahead and move on.
Thank you, Madam Chair. Justin Luna for the record. Page 41, problem gambling, budget account 3200. Provides programs that expand and improve the treatment and prevention of problem gambling through workforce development, research and evaluation, and increasing the number of treatment facilities and providers in Nevada. There are no major closing issues or 4 other closing items, including Appropriations Act language. Any questions on this budget account?
Looking around, I don't see any questions. Go ahead.
Thank you, Madam Chair. Justin Luna for the record. Page 43, the next budget account, alcohol tax program, budget account 3255, increases services for the prevention of alcohol abuse and alcoholism, and for the detoxification and rehabilitation of substance abusers. There are no major closing issues. There's 1 other closing item. Any questions on this budget account?
I don't see anyone. Any questions? Don't see any. Go ahead and move on to the next one.
Thank you, Madam Chair. Justin Luna for the record. Lakes Crossing Center is the next budget account on page 45, budget account 3645. Lakes Crossing Center provides statewide forensic mental health services in a maximum security facility to mentally disordered offenders who are referred to the court system in order that their competency can be restored, or who require mental health services in a secure setting. The facility is located in Sparks in Washoe County on the NAMS campus. There are no major closing issues. There are 13 other closing items. I'll note other closing items 7 and 8 are contingent on enabling legislation. And other closing items, 11 is a reduction in federal funds, and fiscal staff recommends a technical adjustment to add back in ARPA revenue that is projected by the agency. 12 is similar to decision units that we discussed in other budget accounts, and fiscal staff would recommend that the subcommittee's recommendation for this item be consistent with the subcommittee's action on decision unit E652 in the NAMS budget account and the SNAMS budget account 3162 and 3161 respectively, along with Appropriations Act language. And I'll note additional information on page 47 for this budget account. This is information that was identified after the budget hearing, and in a follow-up request for information after the budget hearing, the agency stated there were some indications that court orders in Washoe County could result in contempt fines due to the division's inability to transport clients to the forensic inpatient setting within 7 days per case law. Subsequently, on April 9, 2025, the agency notified fiscal staff that these sanction fines may be levied at a higher rate than previously anticipated based on court orders. The agency indicated that it does not have sufficient funding to cover these additional costs and provided preliminary estimates on the potential impact of ongoing district court sanction fines to the Lakes Crossing Center budget account at $1 million in fiscal year 2025, with a request for an interim finance committee contingency account allocation potentially being submitted for consideration at the June 18th, 2025 interim finance committee meeting, and a projected funding shortfall of $3.6 million in each fiscal year of the 2025-27 biennium. The agency indicated it is in discussions with the governor's finance office on potential solutions to address the projected funding shortfall. Any questions on this budget account?
I do have a question. If you can just elaborate a little bit. I know that down in the 8th Judicial District Court in Clark County, we were receiving fines because we weren't able to move people within 7 days of a court order. And it's my understanding that the 2nd Judicial District Court in Washoe County is now doing a similar item. Can you maybe address that a little bit more in detail on what updates you've received regarding that?
Yes, Madam Chair, thank you. Justin Luna for the record. So the agency provided information on the district court in the south, and the agency has paid fines to date through February 2025 totaling $181,500, and that's noted there on page 47, or 47, excuse me, on page 47. Recently, the Southern District Courts have not levied fines against the agency, and the agency has indicated that that is largely due to the agency and the state's efforts to address the forensic wait list and wait times by implementing, where the agency has implemented several different programs, that several of which we've talked about today. The upcoming addition of 21 forensic beds at the SNAMS campus for Building 3A, the implementation of the jail-based programming with ARPA funds, the use of skilled nursing facilities using the ARPA funds. So the state's efforts and the agency's implementation of those efforts has, it appears, provided some good faith with the Southern District Court. However, some of the wait lists and the transfer of individuals to the northern facility at Lakes Crossing has impacted the wait lists for that facility, and Washoe County District Court has recognized that and has been in discussions with the agency on how they're going to address that, which has resulted in these court orders. And signs indicate from the agency that those orders could be increasing for other offenders that are awaiting forensic transport or transport to the forensic facilities. And so they're raising this concern about a potential shortfall in the current fiscal year, which they're working with the governor's finance office on, and also looking for solutions to address potential shortfalls for increases that could occur in the upcoming biennium. The agency did indicate that the Washoe County Court has levied fines, known fines of approximately $200,000. So the $1 million for the fiscal year 2025 and the $3.6 million in each fiscal year of the upcoming biennium are projections based on calculations that the agency provided. So please let me know if you have any other questions.
I don't think we have any other questions. I don't see anything from the committee, so we can move on to the next one. Thank you for that.
Thank you, Madam Chair. Justin Luna for the record. The final budget is the Rural Clinics budget 3648. Rural Clinic program provides community-based mental health services in 12 rural Nevada counties. There are no major closing issues. There are 10 other closing items. And on page 9, or page 15, other closing item 9, I'll note the elimination of state position for contract expenditures. Again, E652, fiscal staff would recommend that the subcommittee's recommendation for this item be consistent with the subcommittee's action on decision unit E652 in the NAMs and SNAMs, budget accounts 3162 and 3161 respectively, and also budget amendment for the reconciliation of the reduction on Healthy Nevada funds is other closing item number 10. Any questions on this budget account?
I don't see any questions. Thank you for that.
Thank you, Madam Chair. Justin Luna for the record. On page 51, as previously noted, fiscal staff is responsible for developing closing recommendations for the following budget accounts. To assist with the closing, fiscal staff has identified the budget accounts that are recommended to be closed as recommended by the governor, along with identified technical adjustments and budget amendments that are recommended below, and requests authority for staff to make other technical adjustments as necessary. Fiscal staff recommends that the following budget accounts be closed as recommended by the governor with the noted technical adjustments and budget amendments, and requests authority for staff to make other technical adjustments as necessary. 3165, crisis response, with other closing item 4 being closed consistent with the action recommended for major closing issue 1 in the behavioral health prevention and treatment budget account. 3170, and including recommending approval of budget amendment A255203165 as noted under other closing item 5. Budget account 3200, problem gambling, with recommending approval of inclusion of language in the Appropriations Act as noted under other closing item 4. Budget account 3255, alcohol tax program. Budget account 3645, Lakes Crossing Center, with other closing items 7 and 8 contingent upon the passage and approval of enabling legislation. Other closing item 9 contingent upon the approval of decision unit E906 in the Office of Health Administration, budget account 3223, and Health Care Facilities Regulation, budget account 3216. Other closing item 11 be closed with the noted technical adjustments to reflect ARPA revenue of $1.2 million in fiscal year 2026 and $1.1 million in fiscal year 2027 for clinical contract staff based on projected grant authority. Other closing item 12 to be closed consistent with the subcommittee's actions on decision unit E652 in the Northern Nevada Adult Mental Health Services budget account 3162 and Southern Nevada Adult Mental Health Services budget account 3161, and recommending approval of inclusion of language in the Appropriations Act as noted under other closing item 13. And budget account 3648, rural clinics, with other closing item 7 contingent upon the approval of decision unit E906 in the Office of Health Administration budget account 3223. Other closing item 9 be closed consistent with the subcommittee's actions on decision unit E652 and the Northern Nevada Adult Mental Health Services budget account 3162 and Southern Nevada Adult Mental Health Services budget account 3161. And recommending approval of budget amendment A255113648 as noted under other closing item 10 to reconcile a reduction in revenue authority.
Thank you. Any questions regarding that? If not, I'd entertain a motion.
I motion to approve as stated by staff.
Second?
I have a motion from Assemblymember Mosca, a second from Senator Dondero Loop. Any further discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries unanimously, and that ends the last and final budget for today. And so I will close the agenda item on budget closings and move to our last agenda item, which is public comment. If I can ask anyone to come up to the table that wishes to speak in public comment, do so now. I don't see anyone in Las Vegas. I don't see anyone coming up to the table here in Carson City. If we can go to the phone lines for anyone to testify in public comment.
Thank you, Chair. The public lines are open and working. However, there are no callers to provide public comment at this time.
Thank you. With that, I will close public comment and meeting adjourned.